Thank you everyone for getting on. My name is Monica Jean. I am a field crops educator in the Upper Peninsula of Michigan, and we have a lot of snow. I am also on the North Central Climate Collaborative. And our work, although many of you probably know since you're getting on this webinar today, but our work is to increase the flow and usability of climate information for extension, farmers, natural resource managers, and communities by hosting these webinars on climate and water throughout the we've been doing it now throughout 2018 and now in 2019. And so we find this is a great resource for those who are interested in this climate change work. And today we have a webinar about climate change and human health. Angie, if you don't mind, go ahead and turn on the first, I think the pre-webinar poll is on. And so if everyone could please go ahead and answer those couple questions. The first one is, what best describes your role or what organization you work for? And then the second question is, in a typical year, about how many farmers do you advise? So we usually leave that open for a couple minutes, and then as we get into our presentation, we'll close that down. So if you could please answer those questions, that'd be great. There will also be a post-session quick poll for everyone to fill out. As we move through our talk today, if you have questions, if you could please put them into the chat box, I will be manning that. Otherwise, if there is a very specific question, like on the slide that maybe Elena has up, then I will try to get those answered right in the moment so we don't pass by. Otherwise, we'll discuss those at the end. So if you could please hold your questions to the end, that would be great. If there's nothing else, I think we will go ahead and move on to our presentation. It's called Climate Change and Human Health. Today we have Elena Grossman of the UIC School of Public Health and Colleen Moran of the Wisconsin Department of Health Services. Elena will be our first speaker, and she's going to be giving an overview, and then Colleen's going to kind of dive into the topic. And with that, go ahead, Elena.
Thank you. I'm just going to pull up my presentation. All right, as Monica said, my name is Elena Grossman, and I am the program manager for Building Resilience Against Climate Change, Building Resilience Against Climate Effects in Illinois, and I'm at the UIC School of Public Health. Colleen also manages a similar program, but in Wisconsin, and CDC funds 16 states and 2 cities, and the goal is to, broadly speaking, build the capacity of the state or city's public health system to be able to better address the health effects from climate change. So I'm first going to start off with Grover. I'm sure many of you remember Grover, either from childhood or maybe with your children. But this is his famous shtick of near and far. And I like to use this to talk about how humans, from a psychological perspective, have a really hard time identifying with things that feel far away. So when we look at this map showing the projections of extreme precipitation events happening, looking at the later end of next century, so 2080 to 2100, compared to the later part of this past century, 1980 to 2000. And in a nutshell, there will be more. But it's really hard to think about what is going to happen in 80 years. When you're in job interviews, we all dread the question of, where do you see yourself in 5 years? Because it's really hard to think about where you see yourselves in 5 years, let alone in 80 years. So what people connect to is events that have happened. These are images of various floods throughout the Midwest in the last 5 to 6 years, and you can see the catastrophic damage that they've created. And people connect to this. It's relatable. We've all been hearing about all of the extreme weather events of wildfires, floods, hurricanes. We know and can see this. We can relate to how these events occur, the destruction and the damage. That's not to say that projection information isn't important, especially from a planning perspective. But when talking about climate change, specifically around health, it's the here, it's the now, it's how it's affecting ourselves, our families, our children, and our communities. And so this is actually from the Yale program on climate change communication, and they've been conducting opinion surveys, I think, since 2016, and this kind of shows how over 70% of the country, they think global warming is happening, but just over 40% think it will actually harm them personally. And so you can see how it's hard to connect climate change happening and climate change affecting us. And in the public health world, we've been trying to shift this conversation from what's going to happen in the future, it's going to affect polar bears and glaciers, to how it's affecting human health. So when we talk about climate change and health, we're talking about how climate change is leading to these environmental changes, more extreme heat events, more floods, worsening hurricanes, more wildfires in a longer season, more droughts, worsening air quality, a geographic expansion of vector-borne diseases, vectors, and then you have a whole slew of health effects. I am now going to go into a little more detail. I'm not going to really focus on hurricanes as much as the other ones, but I'm going to provide a little more information about how climate change has affected these various aspects of health. So we're starting with heat. This is actually an image from the 1995 Chicago heat wave, which killed over 700 people. This is an image of a mass grave. The county's coroner's office was so overwhelmed with unclaimed bodies that they had to create mass graves. It looks like it's an image from a war-torn country, not from the city of Chicago after a heat wave. The reality is that heat is actually the most fatal of all weather-related activities. So this is from the National Weather Service, and it shows different weather events at the bottom and fatalities connected to it, both from 2017, but then a 10-year average, which is blue, and a 30-year average, which is yellow. And you can see that heat, in long-term, has the highest fatality rate of all events. It's a silent killer. You can't see a heat wave like you can see a flood or a wildfire or a tornado or a hurricane. When we're talking about heat, we're talking about a spectrum of heat stress illnesses, ranging from the more benign syndromes like a heat rash or heat cramps, moving into more extreme ones like heat exhaustion and heat syncope, and then finally heat stroke, which is the most fatal. And basically your body isn't able to cool itself down. A big symptom is not sweating. And when your body can't cool itself down, then that can lead to organ failure. Certain parts of the country that have a higher risk for heat waves, and one phenomenon is called the urban heat island effect. And this is basically where there's more asphalt, more concrete, more cars, not as many trees or vegetation, and that can all increase temperatures up to 5 to 10 degrees potentially. So that's posing urban areas at a greater risk for heat-related illness. However, rural areas can be just as vulnerable. Here in Illinois, we analyzed heat hospitalization data between 1987 to 1994 at the county level. So the map that you're looking at is a map of Illinois by county. The color indicates how rural or urban it is. Red is more urban, purple is more rural, and the dot in the middle shows the heat hospitalization rate. The smaller the dot, the smaller the rate. And you can see that the rate is actually higher in rural counties. This actually mirrors national studies. So this was looking at heat hospitalization data from 2001 to 2010, and I've highlighted one risk factor, and that's hospitalization location. And you can see that rural and small urban clusters, which is between 2,500 to 50,000 people, had their rate was 2 times greater than urban areas. The question as to why that hasn't been studied from a research perspective, But there are many hypotheses. There's more agricultural work in rural areas, so there are just more people exposed to ambient temperature. They live further away from people, so reaching out and knocking on your neighbors' doors, checking in with neighbors, which is a really big factor that they looked into after the '95 Chicago heat wave. There were a lot of older adults who were living alone, and they were found dead in their apartments. But if you live further away from people, it's harder to do that. Being further away from a cooling center, whether it's a designated one or even just an area that's cooler, like a mall, it's harder to get to. Rural areas have higher elderly populations, and they're a big vulnerable population. Those are just some ideas as to why this is happening, but this has been really important for us in talking to rural counties because they don't perceive heat as a threat. Floods, this is another result of climate change where we're seeing more extreme and more frequent precipitation events. There are a whole number of public health implications from floods. If flooded homes can build mold, and that can lead to respiratory health issues. An increased risk in waterborne diseases, which I'm going to go into a little more detail. An increased risk for injuries and fatalities, both preparing for it during the actual event, and then cleaning up. And the mental health aspect of the financial stress, the personal loss, displacement. I'm going to go into more detail as mental health is actually a health effect that we pull out separately. This is a graphic to show the relationship between how increased precipitation events can lead to exposure to disease, both in urban and rural areas. In Chicago, there's a combined water system in which stormwater and sewer water use the same pipes. And so what that means is when there is an extreme precipitation event, they actually intentionally allow the water to spill over into rivers and lakes, drinking water sources, so that there isn't a backup into people's basements that can then compromise drinking water systems. In rural areas, raw sewage and other chemicals from farms can contaminate water sources as well, and drinking water sources. And in fact, we actually have a connection between waterborne disease outbreaks in the US that happen after precipitation events. So this was a study looking at outbreaks between 1948 and 1994, and over half of all waterborne disease outbreaks happened after events that were in the 90th percentile, and 68% of outbreaks happened after precipitation events that were in the 80th percentile in terms of how big of an event it was. Respiratory health, so WHO has determined that there are about 4.2 million deaths every year as a result of exposure to ambient outdoor air pollution. In the US, we're talking about over 105,000 deaths. If we just look at current prevalence of asthma being a respiratory health disease that can be exacerbated by any sort of events, about 8% of both children and adults have asthma here in the United States. That's without anything exacerbating it. So how is climate change connected to respiratory health? So one way is through pollen. When you have higher temperatures and you have more precipitation and you have a longer growing season, that just allows pollen producing plants to prosper. So if you look at this map, this is over a 20-year period, 1995 to 2015, and it's showing a change in the length of pollen season. So the red dot shows an increase, blue shows a decrease, and the size of the dot is supposed to give an idea as to how much bigger of an increase. So if you look at southern Wisconsin, it's at about 15 days longer over this 20-year period. And in many ways, the further north you go, the longer the season has increased. Ozone pollution is another way that climate change is affecting our air quality. Ozone pollution is a chemical reaction of nitrogen oxide, volatile organic compounds, heat, and sunlight. And the key variable to that equation is heat. With climate change, we'll see rising temperatures, and rising temperatures means that the concentration of ozone pollution will get worse. And ozone pollution is really awful for those with existing respiratory health conditions, whether it's asthma, chronic obstructive pulmonary disorder, sarcoidosis attacking the lungs, but it can also affect those with healthy lungs. And then finally, wildfires. As we've been hearing about the wildfires out west, as there are more wildfires, as the wildfire season is becoming longer, that's putting more particulate matter into the air, and particulate matter can exacerbate any sort of respiratory health condition. And again, it can also affect those who have healthy respiratory systems. Vector-borne diseases, this is probably the more complicated relationship, as there are many factors that influence vector-borne diseases and where they happen, but climate change is one of them. You're looking at our two friends, the Asian tiger mosquito and the Lone Star tick. The Asian tiger mosquito can transmit chikungunya, dengue, and Zika, and basically what's happening is that these vectors are expanding their geographic range as a result of warming, basically being able to live in places where they couldn't live before. So this is looking at the change in Lyme disease cases reported in 2001. On your left, you can see that really it's concentrated in the mid-Atlantic area. So one dot represents one case. But by 2014, it expanded north, south, and west to where in Illinois, you can almost count how many cases happened in 2001, and by 2014, you can't. And almost the entire state of Wisconsin is covered with cases of Lyme disease. So how is it connected? Again, I said it's probably the most complicated relationship because vector-borne diseases are also connected to globalization and land use and the life cycle of the actual vector. But in terms of climate change, as I said, if you have these warming temperatures, it's expanding their geographic range, but also higher temperatures in the winter mean that more ticks are able to survive. The more ticks you have, the higher the probability that a tick will be a carrier for a disease, and then the higher probability that you can be bit by a tick carrying a disease. Higher temperatures also, the way that I like to think about it is that it speeds up they grow up faster. So ticks grow up to the point where they're feeding, and so their feeding period is longer. And for mosquitoes, it actually makes them hungrier. So at least that's how I like to explain it. So there's an increased biting rate. And this is an image to look at the life cycle of the black-legged tick. And you can see how, because there are earlier springs and later falls, that extends the biting season. So there's just a higher risk. It's really a probability game. There's a higher risk for being bit by a tick with a disease. Harmful algal bloom. This is a beautiful picture, aerial shot of Lake Erie when there was a really large harmful algal bloom, and people were turning on their tap water and it was green. Harmful algal blooms can have a number of health effects. There's a number of ways to be exposed to it, whether it's through skin contact, by swimming. You can also breathe in the tiny airborne droplets, and you can also consume it by drinking or eating contaminated food or water with HAB toxins. The health effects can range from irritations of skin, eyes, nose, and throat, respiratory illness, gastrointestinal illness, and I believe that there's current research on looking into it as a possible carcinogen. And so it's connected to climate change because as there's more heavy precipitation events, that's leading to more runoff of nutrients from farms, and then warming water favors growth of some types of toxic algae. And then finally, mental health, as I mentioned earlier, the exposure to these extreme weather events is very traumatic, both during and after. Maybe you see someone who actually gets hurt, or maybe you see someone who dies. Also, as I mentioned previously, the financial damage to a flooded home or a burned down home. Displacement. You don't know how long you'll be displaced from somewhere, and the traumatic outcomes from that. So after Hurricane Katrina, there was a study that looked at over 800 people, and they looked at how many of those people were presenting with certain mental health conditions 5 to 8 months after Katrina, and then a year after Katrina. And you can see that all of those conditions, actually the percentage of people presenting with the conditions all increased. So this isn't a problem that is just that is just after the event, but it can have long-term outcomes. To the point where in 2017, mental health providers coined a new term called the Katrina brain, where they were seeing cognitive disabilities and memory loss issues, and just this long-term toll of hurricanes, of floods, of wildfires, of these extreme weather events. But even experiencing something like the 1995 Chicago heat wave, where over 700 people died, that can be a traumatic experience as well. So I just wanted to end with quotes from Leslie Knope, who is from the sitcom Parks and Recreation. And, I presented a lot of facts and science. And it's a challenge that we have in talking about this, because people hate facts and science. And this is actually from an episode where they talked about putting fluoride in drinking water. And there's a big outlash against it. Obviously, it's a comedy, but there's something to it. And how we talk about climate change and health is really important in really getting our point across. And with that, I am finished. So thank you for your attention. I believe Colleen's going to take it from here.
Yes, thank you, Elena. That was great. If you want to go ahead and stop sharing your screen. And then Colleen, sorry, if you want to go ahead and share your screen. Perfect. We can see it.
All right, great. Can you hear me okay?
Yes. Perfect.
All right. Well, thank you, Elena. That was a great segue into what I want to talk about this afternoon. So again, my name is Colleen Moran, and I'm the Climate and Health Program Manager at the Wisconsin Department of Health Services, and I am one of Elena's colleagues. She and I are both program managers of the same grant, the Building Resilience Against Climate Effects CDC grant. So I'm going to be going into a little bit more detail on what the implementation of that grant actually looks like. And I'm hoping to be able to explain what my various colleagues and I are doing to help sort of mitigate the negative public health impacts of climate change. I do encourage you to explore our website. It's linked on my first and last slides of my presentation. And a lot of the tools and resources that I'm going to mention today are available on our website. Also, my contact information is there if you want to follow up with me later on with a question or to obtain a tool or resource that maybe isn't available on our website. Just go ahead and send me an email. I'll be happy to help you out. So I've got about 20 minutes to talk about a whole lot of stuff. So I just wanted to give you a brief overview of what I want to talk about today. I'm going to start with some of our successes, share with you some information about some local projects and tools that we've worked on, and then update you on what we're working on currently. So first, I'd like to start with our successes. So like the other BRACE programs, we spent the first years of our grants completing projects that fulfilled a BRACE 5-step framework that I'm going to briefly explain by describing the work that we did with each of these steps. So this is that BRACE 5-step framework that Elena and I and our colleagues have all been implementing over the past several years. So as Elena mentioned, we are a program funded by the Centers for Disease Control and Prevention, or CDC. And Wisconsin's been funded under this grant since 2012. We're one of 16 states and 2 cities that are currently funded through this program. And this slide just depicts the 5-step framework that all of us grantees have been implementing over the past several years. So the first step of the BRACE framework is forecasting climate impacts and assessing vulnerabilities. So for the first step of this framework, we completed several projects in our first round of funding, and we continue to expand our knowledge on these issues. So the first project that we completed was a climate and health profile report. We completed this pretty early on in our first round of funding, and what we did was use downscaled climate modeling and historical climate data that was provided to us by our friends at WICI, which is the Wisconsin Initiative on Climate Change Impacts. And that's a group of folks that we continue to work with currently and hope to in the future. Another project that we worked on was the Wisconsin Heat Vulnerability Index. This assesses where geographically our most vulnerable populations in Wisconsin are located during the case of an extreme heat event. It includes 24 different data layers that were compiled into an index, and the four main categories of data include population density, the built environment, health indicators, and socio-demographic variables. This index has been shared with our local public health and emergency management, tribal health directors in Wisconsin, and tribal emergency management as well. The Heat Vulnerability Index mapping for Milwaukee and Wisconsin is a peer-reviewed journal article that was written based on the heat vulnerability work that I just mentioned. And then finally, a flood vulnerability assessment was conducted in the Upper Fox River Valley, an area that traditionally floods in Wisconsin, to assess both the human health impacts as well as the economic impacts of flooding. This analysis was conducted using a program called HAZIS, which is a hazard assessment tool created by FEMA. Step 2 of that BRACE framework is projecting the disease burden. So for step 2 of the framework, we completed 2 different projects. One was a project we worked on with a consultant who projected heat-related mortality in Wisconsin using an EPA-developed tool called VenMap. And the second project was a project we worked on in conjunction with a colleague named Chris Wejo of Florida State University. And this project was projecting gastrointestinal illness in Wisconsin, which resulted in a peer-reviewed journal article entitled Drinking Water Treatment, Climate Change, and Childhood Gastrointestinal Illness Projections for Northern Wisconsin Communities Drinking Untreated Groundwater. For step 3 of the framework, which was assessing public health interventions, we actually worked collaboratively with some folks in other GRACE grantee states, including Elena. We also worked with our colleagues in Michigan, Minnesota, North Carolina, and Florida to conduct the following intervention assessments that you see here on the slide. Wisconsin completed the intervention assessment circled in red, and so we conducted intervention assessments on waterborne disease, mold, and harmful algal bloom. We're currently in the last stages of finalizing versions of these intervention assessments that are tools geared for local public health and local emergency management, and they will include Wisconsin-specific considerations. Step 4 of the BRACE framework is developing and implementing a climate and health adaptation plan. We created a climate and health adaptation plan collaboratively with both internal and external partners who work on climate and health related strategies in Wisconsin. The plan outlines both current and future climate and health related strategies the Climate and Health Program and its partners are and will be implementing.
Colleen, it looks like
Yeah.
we have a question. Karina, I have just allowed you to talk. Do you want to go ahead and share your question? Or did you accidentally press the, oh no, it was an accident. Okay, I'm sorry.
That's okay, not a problem. Always excited for questions. So the final step of the BRACE framework is evaluating impact and improving quality of activities. So we did work with an external evaluator from the Wisconsin Population Health Institute to complete a program evaluation, and we're currently continuing our evaluation efforts with an internal evaluator to increase programmatic capacity and within our program. So sort of switching gears and moving over to a quick conversation about some local projects and tools. So these projects are not within the BRACE 5-step framework, but we have focused a lot of our efforts here in Wisconsin on local climate and health adaptation work. Many of our successes have been accomplished through work at the local level. Wisconsin's a home rule state, so it's been useful to implement climate and health adaptation strategies at the local level. And the local health pilot projects and extreme weather toolkits I'm about to explain are 2 examples of this work. So the Climate and Health Program funded 2 cohorts of mini grant pilot projects in local health departments across Wisconsin between July 2014 and September 2016. You can see those indicated on the map on the right. We worked closely with each of these pilot projects to create a community engagement process in which each community was able to identify which climate-related health impacts were of greatest concern to them, what adaptation strategies seemed most feasible, and action plans for implementing these adaptation strategies. Based on these mini-grant pilot projects, the Climate and Health Program created a Climate and Health Community Engagement Toolkit, which is available on our website. This toolkit was created to assist other local health departments and tribal health agencies to create their own local climate and health adaptation plans. And as I mentioned, another strategy that we implemented at the local level was the creation of extreme weather toolkits. These toolkits are targeted at local public health professionals and local government officials. They outline the health impacts of various extreme weather events and how to respond to them. This work has helped local public health agencies and emergency managers to better understand how to prepare for and respond to extreme weather events, making local communities more resilient to the impacts of climate change. So now I wanted to switch gears again and talk about what projects we're currently working on. So that was sort of a summary of what we did in the first few years of our grant, the first 2 years of our grant. But we've been streamlining our efforts a little bit more in this current grant cycle. So with our second round of funding, our overarching focus throughout all the work that we are doing moving forward is health equity. And we're structuring our adaptation strategy efforts on 3 main categories of interventions structured by exposure pathway. And I'll show what that means right here with this beautiful slide. Hopefully, yep, here's loading. So this slide was provided by the Climate and Health Program at the CDC, and it does a really good job of illustrating the exposure pathways that we are structuring our adaptation interventions on. So this is also a really good summary of everything that Elena explained in her presentation, sort of those connections between climate change and public health. So we're choosing to focus our intervention strategies on flooding, extreme heat, and vector-borne disease. And so I just want to briefly explain what those different intervention strategies are that we're implementing right now. So for flood vulnerability, we've been working on 2 multi-year adaptation strategies. One is a Wisconsin flood risk map application. It's an interactive online ArcGIS mapping tool, and it provides data layers such as, but not limited to, healthcare facilities, National Weather Service advisories, current precipitation, the FEMA 100-year floodplain, and the CDC's Social Vulnerability Index. So this is a customizable tool that folks can click what layers they want to look at to check out flood issues, depending on what their interests are. We made it to help better understand flood vulnerability and risk in Wisconsin, and to help inform flood preparedness and response efforts. The tool is intended for a variety of different audiences, including city and county and regional planners, local, regional, and state emergency managers and emergency preparedness, healthcare emergency readiness coalitions, as well as the general public. Currently, it's in its final phases of getting ready to be disseminated. We have a webinar that it will be occurring on March 18th. It's going to have a demonstration of how various stakeholders use the tool. If you're interested in attending, please just send me an email and we will get you signed up for that. And the website will be live and available on our Climate and Health homepage for consumption by the general public in the next couple of weeks as we're getting ready for this webinar. The other big flood adaptation strategy that we have been working on for the last couple of years is called a Flood Resilience Scorecard. It's a multiple choice scorecard that provides tailored community-specific recommendations for how to become more resilient to flooding events. We made it to help municipalities decide what actions to take to protect their communities from a future flooding event. The tool answers questions about a community to learn what actions to take, such as assessing environmental features of flood vulnerability, developing sustainable community policies and plans, and building social resilience through outreach and partnerships. It's intended for municipal officials and community planners. Currently, it's being piloted in 2 different University of Wisconsin courses. A UW-Platteville undergraduate senior engineering workshop is piloting it, and they're working with a village of Viola, Wisconsin. Also, UW-Madison master's level urban and regional planning course is working with the city of Middleton, Wisconsin, and the Pheasant Branch Conservancy to pilot this tool. We have a summer graduate student intern who's getting his master's degree at the Nelson Institute of Environmental Studies. He is ready to take this project to completion. He's going to take the findings from these 2 pilots and implement those recommendations over the course of the summer. We'll be updating the tool based on student and municipal official evaluation input. So those are our 2 major flood adaptation strategies. So now I'm going to move on to an extreme heat adaptation strategy that we've been working on over the last couple of years. We piloted a tool developed by the Centers for Disease Control and Prevention called a Community Assessment for Public Health Emergency Response, or CASPR. It's a quick and low-cost epidemiologic technique designed to provide household-based information about a community. It allows public health and emergency managers to make informed decisions in order to better prepare for and/or respond to a disaster. CASPRs are most often used after a major natural disaster, such as a hurricane or a flood. We chose to conduct a CASPR for a variety of reasons. We wanted to build capacity at the state and local level for future CASPR implementation. We wanted to better understand levels of knowledge, ability to cope and respond during an extreme heat event. And we wanted to inform future extreme heat plans in the community that the CASPR was being conducted in. We selected Milwaukee, Wisconsin as the geography for the implementation of this pilot. And this location was chosen based on prior research that demonstrates that this location is one of the most vulnerable during an extreme heat event. And that prior research is the heat vulnerability index that I referred to earlier on in our presentation that indicated that Milwaukee was particularly vulnerable during an extreme heat event. A CASPR is conducted through a randomized 2-stage cluster design that collects household level data, usually over about a 2-day period of time, with an ultimate goal of collecting 210 completed surveys. The data results and findings of the CASPR are intended for a few different audiences. One, the Milwaukee municipal officials to help them inform extreme heat plans and communication about extreme heat events. Milwaukee community groups to increase local knowledge of how to cope with and adapt to extreme heat events. And also internally, the Wisconsin Department of Health Services to help build capacity for future CASPR implementation. We've already hosted an internal data party to discuss internal capacity building, as well as hosting an internal brown bag. And moving forward, we'll be hosting an external data party actually just in 2 days with our key Milwaukee partners to discuss what the data results mean and help them inform us on the final report. And also help inform our dissemination plan and activities, because we do want to ensure that we're returning the data back to the community that we obtained it from. Our final CASPR report is taking the form of an academic journal article that's going to be co-authored by us and our Milwaukee key partners. And again, we're going to be working on building internal Department of Health Services capacity for the conducting of future CASPRs. Now, finally, our final exposure pathway that I mentioned was vector-borne disease. We're continuing to work with some internal Department of Health Services programs, such as the Wisconsin Environmental Public Health Tracking Program and the Wisconsin Vector-Borne Disease Program, to create and disseminate educational materials, things like tick wallet cards, tick removal kits, and vector-borne disease videos that are on our website for both local health agencies and the general public. So I apologize, that was a lot of information on one slide. Thanks for hanging in there with me. So I do want to mention that while we focus our adaptation work based on exposure pathways that I just mentioned, we do so with the understanding that the public health impacts of climate change are not felt equally by individuals and communities throughout Wisconsin. Who is most impacted depends a lot on how vulnerable people are to the negative health impacts of climate change. This is why our overarching focus on health equity is guiding the work that we do. In order to focus on health equity in our work, we're directing our efforts to working with priority populations. And this list of priority populations we obtained from the U.S. Global Climate Change Research Report, the Climate and Health Assessment that came out a couple of years ago. Those priority populations that we are focusing our efforts on are those with low income, communities of color, immigrant groups, Indigenous peoples, children and pregnant women, older adults, vulnerable occupational groups, persons with disabilities, and persons with pre-existing or chronic medical conditions. These priority populations are of greater concern when it comes to climate and health issues because they are more vulnerable to climate impacts. In order to ensure that we're working within the lens of health equity, we're utilizing our internal equity advisory team, which is comprised of individuals at the Division of Public Health who manage programs that focus on these priority populations. This advisory team helps us to ensure that we're implementing and evaluating our implementation strategies appropriately. I just wanted to mention that vulnerability to climate related health effects encompasses 3 pieces. It's the tendency or predisposition to be adversely affected by climate-related health effects, and it encompasses exposure, sensitivity or susceptibility to harm, and the capacity to adapt to or cope with change. So I apologize for how much information I threw at you in about 20 minutes, but hopefully it was digestible. I just wanted to finish by saying that our plan for the last 2 years of our current grant cycle is to finish our current projects and focus our efforts on institutionalizing climate change and equity work within the Division of Public Health. We will also focus on revisiting step 4 of the BRACE framework and updating and re-envisioning our climate and health adaptation plan. So I do hope that this really quick 30,000-foot overview of our work has helped demonstrate that our ultimate goal is resilience. We strive to better prepare Wisconsin to plan for and respond to extreme weather events and climate change impacts. This is our hope in the face of a changing climate, that we can help Wisconsin adapt to the health impacts of the changes happening around us. We and our other 15 states and 2 cities that are working on this BRACE grant together. Before I end, I just want to thank my team. We are small but mighty. These people all add up to be about 1.8 people FTE, but we get a lot done. I couldn't do it without them. And again, here's my contact information and our website in the bottom right corner of this slide. And that's what I had for today. So hopefully there's some questions.
Yeah, thank you so much, both Elena and Colleen, for getting on today and sharing such great information. There was first a comment for Elena. Elena, when you were talking about reasons for why we see the stress on people almost as high out in the rural areas, and we typically think of it happening mostly in the cities, the urban dense. Someone made a comment that the rural counties also in general have older homes that are harder to cool and have poor electric supplies that cannot always keep up with the peak summer demand.
Yeah, that's a really great point. Again, I'm not aware of any, research or traditional research that has happened to assess the risk factors. But that's a really good point that rural areas have older homes and it's harder to cool down.
Yeah. And then for Colleen, we have Kate Compton has sent you her email on our chat here, and she said to please add her on for your demonstration of that tool on March 18th, if that works for you. Do you see it right there in the Zoom webinar chat?
Yes.
Okay. You have a couple other ones too.
Oh, sure. Will this be, will the chat feature be saved somewhere or will it disappear immediately?
I think it just saved. Oh, it does save. All right. Angie knows it. It's
great. Then I can scroll through and make sure I have everybody.
And Angie, while we're finishing up here, do you mind sharing the post session poll so people can start to enter into that while we answer questions? Thank you so much. So if everyone can please answer these questions here that just popped up. The first one is, did you learn something that will be useful? We hope so. And are you likely to share this information from the webinar? The next question was a comment question. It says, I am struck by how the architecture you are using to assess health for people parallels health for farms and farm animals. We want to use sure to use farmers concerned about climate change and wonder if you or others you know have done something like this. For instance, we have these scorecards, flood resilience scorecards you can go out for the farmers to complete. There's also a lot of soil health scorecards that kind of we're trying to, link soil health to building resiliency, and the resiliency to our, of course, climate change is another link that we typically use in agriculture. Do you guys find that you're working in that realm? It's kind of what I think this person is.
When you say in that realm, is that in reference to the farming community?
Yes. Is there a flood resilience scorecard done for farmers is what I think he's specifically.
Sure. No, I think that's a great question. I can't speak for Elena. As far as I know, I'm not aware of a flood resilience scorecard specifically for farmers, but it's a great idea. I mean, ours were meant for municipalities, which are often surrounded by farms, so it would be an obvious next step. Maybe that's where we can take the tool eventually, but I'm not aware of one right now, no.
Okay. I was also wondering when you said that there are people who are in jobs that make them vulnerable, would you be...
Those are often farmers.
Yeah, that's kind of what I was thinking. Okay.
Oh yeah, absolutely. Anybody working outside construction, agriculture, those are our high-risk populations when it comes to extreme heat events in particular. Yeah.
All right.
Yeah, I would just, again, we've actually been wanting to connect with the farming community in Illinois, and we have a little bit, but not too much, and that might just be because, we're connected primarily through the health department and the local health departments, and we just haven't had the connections yet that have kind of helped us facilitate the conversations. But we often talk about health of, as Colleen said, a lot of the occupational health populations as being priority populations, but then also thinking about the financial and property loss component to floods and how that affects the farming community. And so we've, also how climate change can affect yield production. And again, kind of getting at the financial and the mental health aspects of climate change affecting the farming community.
Well, it sounds like we should loop you in with our NC3 team, because we have ag reps from all over the North Central region. So the next question we have here is, do you know if other states have attempted similar preparedness details as like what you guys showed today? And this guy or lady, I guess I can't tell, says, I'm in Iowa.
Sure. Elena, go ahead and jump in, but I mean, as I mentioned, and I apologize for not showing the map, but I mentioned there's 16 states and 2 cities funded through this work that Elena and I are doing. And so, yeah, besides Elena and I, there are 14 other states. Don't ask me to name them all. And then the city of New York and the city of San Francisco are also working on this. And so we're all tasked to implement that 5-step BRACE framework that I shared with you all. And so we all have our own individual jurisdictionally specific adaptation strategies, but yeah, we're all working on this sort of work. And then I believe there are some other states and cities that are working on this as well, who aren't necessarily funded through our grants. But Elena, I don't know, do you want to jump on that?
Yeah, I know that Iowa is not one of the BRACE states. But yeah, I'm not totally sure which states, and I know cities, and I think even some counties are working on this. They did recently add on tribal communities. So CDC is now funding some tribal communities. I'm not exactly sure where, but they've tried to branch out into other communities to get this work started.
So if someone wanted to find out if it was in their area, would that be the previous website that was shared? I think it got shared at the beginning. Or do you have another one that they can use?
I could find it right now. It's just if you Googled CDC BRACE.
Yeah.
Okay.
And I can find it and send it to you right now. Or can I put it in the chat feature?
Yes,
can I see that?
You can.
Oh, there we go.
Make sure to select all panelists and attendees.
Okay.
All right. And And then the next
So much.
question here, well, Colleen finishes up that one, is there any research that indicates garden rooftops in urban areas would reduce the urban heat island effect?
Yes.
Yes, absolutely. I think there's a lot of research that indicates that. And I think that our flood resilience scorecard actually originally started as a green infrastructure tool. So things like green roofs, increasing urban trees, things of that nature that reduce heat but also absorb water. Absolutely, there's research that demonstrates that, yeah.
And there's also research that demonstrates the co-benefits of climate and health effects, but then also other health effects that relate to obesity and heart disease. So thinking about, and then also respiratory health. So thinking about making public transportation better, more accessible, or bike paths, or making streets more pedestrian friendly. So not only are you helping to try to reduce carbon dioxide emissions, but it can help with cooling, making areas cooler and a little more resilient to heat. It can also help with precipitate flooding events, but then also obesity, diabetes, asthma, anything that can exacerbate some type of respiratory health issue. So there are a lot of co-benefits to some of these interventions, and like the green roof, what it can do is it can help cool down the actual building. So whatever the green roof is on that building can help bring down the temperatures. The same idea of painting roofs white instead of black to help reflect the heat instead of absorb it.
All right, that sounds great. Anyone else have any questions? And while I just wait to see if we have any more coming in, I just want to remind everyone that we will be sending out information on our April webinar in the upcoming weeks. We typically host those on the fourth Monday of the month. And so right now we have not pinned down our topic, but please look out for those in our communication that you've been getting, because there should be something coming out very soon for our next one. Let me see. I don't see any more questions. So if that is all, Angie, is there anything else I need to do to make sure we recorded this and we're good to go?
It is still recording, so any last reminders that you want to state, we can do that, and then we can wrap up today.
All right, well, I would like to just again thank Elena and Colleen for getting on and sharing such wonderful information for us. I know we can't all clap for you, but if you could imagine that. And then again, just remind everyone that you should be seeing the advertisement for our next webinar soon, but it's typically the fourth Monday of the month. So make sure you have that already squared away on your calendar at the same time. And I always get messed up because it's in Central Time. So I think it's 1 to 2 Central Time or 2 to 3 Eastern Time. Otherwise, thank you everyone for getting on, and I hope you have a wonderful week.
Thank you.
Thank you.
Thanks.